here is an investor? Who in here is a philanthropist? Who in here is an entrepreneur? Oh, yeah. Wow. Ecosystem builder type? There, okay. Just trying to get a sense of who's in the room. We'll tell you in a second who we are. My name is Katie Drasser. I'm the CEO of rockhealth.org. This group of people, like literally this group of four over here, me too, but those four are total rock stars. They wake up every day and think about what they can do for youth mental health and how to support youth, mostly in this country, but some more broadly. They fund, they fuel, they support. And so for the last year, we've been working together with a few other partners on trying to map the opportunity landscape for youth mental health to bring more folks like these folks into this space to fund and fuel many of the folks who are in this room. So the report, sort of the genesis behind this panel, behind a lot of what we're going to share, the audience was really for investors, but honestly, we've heard from a lot of entrepreneurs that they can use the data to convince investors or to help build whatever it is they're building. And then for ecosystem players, we're just here to like keep it all moving and connect people and all that stuff. So I just want to set that context. We're going to be a little venture heavy today. Venture is like a small amount of what makes this whole thing, this youth, this mental health, BHT, awesome. We recognize that, but it is an important part of the puzzle. Since 2018, $1 billion a year, according to our Rock Health Venture database, has gone into behavioral health, and it's been growing for youth mental health. So of that, it was 14% in 2018, it's up to 34% for 2023, and we think it's going to surpass that for this year. We'll let you know at the end of the year. So that's why we're here. We have Aaron Seastra from Hope Lab, we have David Ball from Headstream, Kelsey from Pivotal Ventures, and John Bailey from Fiore Ventures. I'm not going to say more about them. I think you all know them. This is like the choir. We're at BHT. So we're going to jump right in. And to start, we're going to just like name the moment we're in. Today's kind of a big day. I'd love, before we dive into like the numbers and the data and the stories, why elections matter and how it's relevant to this conversation. I want to blow past that because it's definitely looming large in this room and all over. So, Kelsey or John, you want to start?
Great. There we go. It's so great to be here. Thank you, everyone. Oh my gosh, standing room only. Elections matter because policy matters. So I know today feels extra heavy, but it is like every election matters. And it matters for federal policy, it matters for state policy. We're very consumed right now with the federal elections. In 2 years, we're going to have elections for governors, and it's a mega election year, which means it's close to like 30, 35 governors are up. The races are going to be decided, at least 20 new governors. And that's going to have a huge impact too, for Medicaid, for a lot of state policy. And so I think the reason this matters for investors, for entrepreneurs, for those of you in philanthropy and nonprofits is because policy matters. And it's why a lot of the work that we do at Fiore Ventures isn't just investing in entrepreneurs, but also investing in a lot of the policy entrepreneurs too. And there's great groups here. We have the Meadows Health Policy Institute, Inseparable, which is just doing great work in all the different states, as well as the Kennedy Forum. We just have good policy partners to help make sure there are the right conditions to set entrepreneurs up for success, but more importantly, to make sure that there are good outcomes for kids and for youth all around the country. So that's why today matters.
And I'll add to that at a time of great division in this country, 90% of adults believe that there is a youth mental health crisis. That is something that is almost universally understood and appreciated. And at this time of division, like there are very few things that bring us together. And youth mental health and really wanting better for our kids is one of them. And it will take all of us. Right now, I think many of us are thinking about the federal stage and kind of federal and state funding policies. At the same time, the day-to-day work continues. All of you have been working in this space before the election cycle began. You will continue that work after the election cycle. And we need to keep in that fight for the well-being of our young people, including with new solutions. So I'm excited for that work to continue even after today.
There's a really interesting YouGov poll survey that came out last week, and they surveyed about 1,000 teens from across the country, and it was the first election that many of them are going to vote on, and others still don't have that opportunity to vote. And so this gives us an opportunity to represent those voices as well. And for the first time in any survey or research that I had seen, for the first time I saw that number one issue that young people wanted lawmakers to focus on was above climate change, above AI ethics, above social inequality, healthcare access and affordability was the #1 issue for teens. And so this is an opportunity for us to represent that and continue the work we do.
And we, as investors, we're often investing in solutions for youth mental health, but the solutions are really downstream of the larger systems at play that are affecting young people and their well-being. And so I think an election is also just a moment of reflection on what are the circumstances, what is the environment in which young people are growing up today, and what are the levers beyond the solutions, beyond healthcare, beyond ed tech, beyond consumer tech, where are the levers where we can actually influence policy and influence the world in which young people live. So it's happened. The election is today. We will see what happens. And it's a chance, again, for all of us to be energized to think of the many different ways we can intervene, not just
So, okay, let's dive into the numbers. There's been a lot of change since 2019. Adoption patterns among youth and then adults as well as it relates to mental health. And the investment dollars are increasing for youth mental health. A lot of different pivots. Anything that has surprised you, anything that's influenced, I mean, you all have been a part of that evolution, but any changes that have influenced the way you're thinking about supporting innovators, the way you're thinking about shifting the space yourself, what are you seeing?
I'm happy to start. So I'm the director of an adolescent mental health portfolio at Pivotal Ventures, which was founded by Melinda French Gates in 2016. And when we first started funding in this area across both the philanthropic and the venture capital space, in 2017, mental health was really still a stigmatized issue. It was not talked about often. And what I saw most from a lot of founders in this space is they were making the case for the problem and trying to explain why we needed new solutions. As much as they were actually selling their own product. And that was a huge burden for entrepreneurs to help carry. Since the pandemic, since 2020, we have seen mental health really kind of come to the forefront of issues that matter to a lot of different sectors. So we see it integrated into primary health care, we see it integrated into schools. Outcomes in other sectors, such as education outcomes, are really dependent on the mental health of the student population. So it's been exciting to see mental health really be centered in a lot of other sectors beyond just kind of a mental health silo. This is very romantic,
the
you
mood
all.
lighting, yeah.
Can we get some candles, like a little bit of lights? But I mean, I think in addition to that, we've seen large patterns in integration. So mental health as an integrated service in other sectors. And then also seeing the role of caregivers and whole family solutions has been critically important. We know that 50% of working caregivers have missed at least a day of work for their child's mental health in the last month. That is a huge number. And I think employers are starting to take notice of that this is also a workforce issue. And so looking at solutions that fit into employee benefits, that target the adult first as a care seeker, is also critically important. So it's been exciting to see that change, and we still have a longer way to go.
Great, yeah. Just a couple, I mean, agree so much with what Kelsey was saying, especially on this sort of integrated family, that we're seeing a lot of solutions that the best way of helping to treat youth mental health is also by supporting moms and dads, but also vice versa too. Like we're seeing amazing maternal mental health solutions, which again, if moms are just getting their needs met, that's gonna have great impact on young people and young youth too, especially in the early ages. And so this integrated care, so important. I think we're also seeing a lot of solutions that are digital first. And it's because this is a generation of youth that are very comfortable and want solutions that are digital. Not also exclusively. A lot of times they want in person, in real life solutions as well, but they are comfortable with digital solutions. And so there's a huge demand for it there as well. Lastly, young people are not mini adults. And so I think there's a lot that we're seeing in terms of co-designing. Hope Lab has been great on this, as well as a number of other groups about co-designing the solutions that youth want in the way they want it with the providers that they want it. That's so important because that's the way you get culturally relevant solutions and services, but it's also the way to make sure that we're just not taking what works for adults and trying to force fit it into youth as well. And then one last point is that one of the things, we're new in the youth mental health space, but one of the challenges we're seeing is that there's very few folks that are just exclusively focused from the investor side as well as the philanthropic side on just youth mental health. And so you get kind of that core group, and then all of a sudden you encounter healthcare venture investors or healthcare philanthropists or education investors, and there's a huge need to kind of unlock them, to help demystify this world for them, and invite them and de-risk this so that they can start investing their capital, whether it's philanthropic or investment into the space. But that's a huge challenge, and it's been so great to have partners like Rock Health that are producing reports and just helping demystify this so that other investors can feel comfortable coming in and supporting the great entrepreneurs in this room.
Erin, I don't know if you want to build on that. You all had a recent report, and David, I know you've thought a lot about this. How do we listen to very people? Again, this is like such the choir. You all know this, but there's some new stuff we're learning around listening to youth, listening to caregivers, what folks want. We're at like adoption of digital health in the US. 80% of folks use digital health. Gen Zers are 11 percentage points higher than every other adult on using digital first tools. 44% of all folks want their mental health virtually first in some fashion. And so we're seeing a big trend here. That's the demand we're seeing. 98% of parents talk to their kids. 98% of parents talk to their kids about mental health. Those are millennial parents who now all, have kids. That's a wild figure in my mind. But you all have been doing a lot of work with Common Sense Media and others on what else are you hearing from youth that is shaping your investment thesis, that is shaping the advice you're giving to entrepreneurs and where you're pushing for change? What else are you hearing?
Yeah, so as you mentioned, Hope Lab recently, I guess not so recently, in June put out our national survey, which we do approximately every 3 years. This time we surveyed over 1,200 young people to better understand their online habits, asking around things like their perceptions of AI, social media, online digital mental health resources, and a few things I think arose from that were notable or maybe even a little surprising. One, certainly around social media, often the conversation from older adults is really focused on the harms and the negatives of social media, and those do exist and are worth discussing. And what we heard from young people was that they really felt like that conversation about them was lacking in nuance. And what they wanted us to know was that, yes, we understand the harms of social media. We're actually actively protecting ourselves against them. And social media plays a really important part in their lives in terms of identity affirmation, connection, finding community, even finding resources for mental health in a way that if we were to just take that away and say the solution is just to, burn it all down, it would actually leave a really meaningful gap in terms of their sort of support and ways that they're coping. And so that was one that I think was quite interesting and shed some light for us. The other piece that I found really encouraging was specifically around adoption of teletherapy and telehealth. And what we found in that survey was that Black and Latinx young people were actually accessing teletherapy at a similar rate to their white peers. And so a lot of the hypothesis around teletherapy has been that it actually can play this meaningful role in increasing access and in parity of access. And it's encouraging to see that hypothesis is actually bearing out. There are, of course, still pretty significant barriers to accessing and paying for care that I imagine we'll continue to talk about on this panel, but to see that technology is actually really playing this significant role in really leveling the playing field and creating more equity and access is really encouraging to see.
We see that trend more broadly in digital health nationally among all ages, Black and brown folks. prefer digital. They're some of the highest and fastest adopters. But the business opportunity is there's still very low satisfaction. There's still, like, who's designing this stuff for whom, how? And I think there's a huge opportunity there. Your data says that, this broader data says that as well. But David, over to you.
Yeah, thanks. Let's see if this works. All right. So, one of the things that when we think about business opportunity, right, and you mentioned workforce shortage as well, like, appreciate it. How about this one? All right, I can hear myself. We start thinking about, like, what's the way to expand the types of care that young people actually want, right? Your research points to, like, young people are going online at a really high rate to find different types of care. Therapy doesn't work for everybody, right? And so when we start to think about that workforce shortage, when we start to think about what young people want from their type of care, we have an opportunity to expand what that looks like. And so Headstream, which works with entrepreneurs through our accelerator program and our residency program, and then brings in 25 young people every year through our youth collective, has an opportunity to kind of create that understanding between different types of companies and the young people and what they want. This last year, we really focused on expanding the types of solutions that we were working with that worked with different types of care providers. So Maria, for example, with Clayful, who's over there, works with coaches who students can go to directly within 60 seconds, I believe is the tagline, and they can reach those coaches for preventative care, right? And so they may not have an acute need, but they're reaching very early on in that process, something that can prevent them. Laura from Modality, who I think is also here, works with paraprofessionals to get them trained up. And so when we think about the workforce shortage, when we think about solutions for young people, let's think about how we expand the types of care providers that exist.
I want to stay with you for a second. Now my mic's not. Oh, here it is. Or John, did you have anything you wanted to jump in on that? You sure? You can jump in later too. You have thought a lot about measurement, and I think I have like a public health background, so my public health friends are like, "What do you mean you're in digital health?" Like, there's a little bit of skepticism. There's some accusation of snake oil. Some of that is well founded in this space. Fine. It matters that this stuff is working. And so I'd love for you to start, David, on sort of how we think about metrics. How do we measure what matters? How do we know if something's working? And then how do we learn from that and iterate as we build and invest?
Yeah, I think there's really simple things, right? So we bring young people into the process of selecting the entrepreneurs for our accelerator and residency program. And through that process, they have agency to make the selections with our team and with other professional advisors who can look at different aspects. And if we hear during that process that they call an innovation a scam or something they can just go straight to YouTube for, we're going to pass on that, right? Because ultimately we're looking for uptake and adherence to drive the type of scale that's going to have the impact it needs. I think when we started at Headstream, we saw a little bit of a chicken and an egg problem, right? So many different entrepreneurs said they needed more resource to invest in impact, and all of the folks who were funding or the customers said, we need to see your impact before we give you resources, right? And that's a common, I see some heads nodding here from entrepreneurs that are probably struggling with that, but we've shifted from that narrative because right now we look for companies where they understand that impact is good for business. By measuring your impact, by understanding what your customers want, that is good for business. And so to avoid taking one step forward and two steps back, by just putting your resources to sales and marketing, invest in that impact, understand how to measure that for your customers, understand how you're providing that value for them.
What about from an investor standpoint, where you all sit?
Outcomes and impact are so important. The work at Fiore Ventures with Carrie Walton-Penner, this is a question she always asks. We understand too, at certain stages of companies, it's going to be hard to have impact, but just have that at the top of your mind about how you're going to measure that. The other thing is it's just, especially in the digital world, it gives you such new rich data that can be used to help drive impact on these types of outcome measures. And we're seeing this in some of our great portfolio companies, Ladder, with BME. It's just that when you have, hundreds and thousands of different sessions and just millions of different data points, it unlocks a different way of sort of telling stories and telling impact and showing outcomes that you just don't get through other, sort of survey measurements as well. The other thing is that we're also trying to use our philanthropic arm as a way of funding studies and RCTs, because we know that's really hard. It's really expensive as an entrepreneur to fund an RCT. And so that's an area that we're trying to explore about how do we use that as a lever. But it's a great area for those of you who are philanthropists. When Katie asked you to raise your hand, that's a really good area because those are expensive studies, but they're so important. They're so important not just to show the outcomes and impact of that company, but it helps build the research base for everyone else, that other entrepreneurs and other folks that are trying to build solutions in this space. And so that's a really good area to be investing in.
I think as from the investor side, and this is something that we've done a lot of education work with our peers in this space, is trying to communicate that mental health is not a single one and done thing. Young people will move in and out of different states of well-being over the course of their adolescence, and we need to build systems that can catch those young people and their families as they move in and out of those systems. And I think that that's a very different modality than in a lot of physical health interventions, in that we can't just look for an outcome, which is a cure, a final finish of a treatment or therapy, but rather, are we seeing young people come and use these services and then stay with those services over time? And it's really important from what we evaluate is, are those young people and their families finding an empathy match or a lived experience match in the provision of services? We see a lot of products, a lot of companies have just very high attrition rates. Some of that is about access issues, but others are young people coming in or their families coming in, spending more time explaining their lived experience to their provider than they are in receiving care. And all of the different systems that have affected them. And we see a lot of then kind of fall off in treatment rates over time. So beyond just looking at the impact effect of the intervention or the therapy, we also really want to see continued services and whether or not that person feels reflected in their care experience. And that matters for young people of all lived identities and their caregivers.
I would also just add, I think efficacy and impact can be defined in really different ways for different kinds of solutions. And so you'll have some that are using well-known clinical assessments. You'll have others maybe that are more consumer-facing or less, formally healthcare interventions where they're asking people if they feel directionally better. And I think that's okay if that's what your solution is designed to do. We're not expecting at a seed stage for a company to necessarily have done an RCT yet. Hopefully someone in this room will fund you to do that. But I think as investors, what we're really trying to understand is there reason to believe that this can affect well-being outcomes? Is there any early data to suggest that it actually does? And for us, as we're investing, we're really trying to understand, is this something that works, and is this something that people will pay for? And when you can have those two together, then we would say, okay, that's evidence of product market fit, and therefore potential for impact at scale. And so there's this really important piece around, yes, being able to articulate the impact, not only to your potential end users, but also to the customers, the payers who are not the end users, and also to your investors. And so it's, I think, being able to really articulate that impact story becomes critical at all stages of the business to really be able to get people on board to even try it, which then hopefully can lead to the impact that you're trying to see.
One, I've heard all of you say when you're looking at deals, one thing they look for, so this is a little advice to everyone in this room, is if you're building for youth, are you involving youth in the build? And it's related to metrics. What do they want? Is it serving their needs? Is it meeting their demand? Is it designed for them? That's not separate from metrics, and I've learned that from all of you. And so do you have a youth board? Do you have some sort of council with a feedback loop to keep making it better and take those metrics and learnings and actually change what you're doing, actually do better for them? I want to, with that in mind, a place we see people get stumped here is in the business models. So again, in the world of startup land, what are the right business models? What actually meets kids? What actually works? We know that 44% of the startups in our database working in youth mental health contract with schools. We know that 1 in 5, nearly half of kids in the US, depending on the day, sometimes it's all the way to half, are on Medicaid, and only 22% of funding is going to startups that contract with Medicaid. That feels a bit like a gap. there's so many ways to be doing this and building, and you all have thought a lot and then done policy work and done other work to really think about how do you create businesses and who's buying this. It's a place we see investors get stumped. So I'm hoping you all can shine a little light on advice you have around this, where you see business models working, where you see opportunity, where we could be building differently.
I can start, and maybe I'll start on an optimistic note, which is it sounds we're building a company in Mexico. And so the fact that I hope it continues to get higher, but I think what we're seeing is that we now have examples of business models in Medicaid that work. Across our portfolio, we're finding companies that are able to contract with Medicaid plans that are more creative around things like value-based care or bundled payments or case rates. We're actually finding, Medicaid reimbursement with certain plans in certain states is actually attractive enough to build a business on. So there's the piece just around Medicaid itself being a channel that is continuing to evolve, but that is actually sort of receptive of and conducive to providing care, particularly in digital health. And then we're also seeing, I think, part of the equation is, were you able to get this paid? And then the other piece is, were you actually able to get people aware of and using the solution? And so, with our portfolio companies, there's the, woohoo, we got our Medicaid contract, and then it's, okay, so now, how are you going to engage members? And I think that's often overlooked as a really difficult part of actually serving Medicaid beneficiaries. You've got member data that is incomplete and out of date, even if you're able to access it through the plan. Sort of very well-founded mistrust sometimes between members and their insurance. And so something that I'm also really excited to see is companies getting creative in the ways that they actually go to market. And so one example, I was speaking with Dr. Travis Gales of Hazel Health and asked sort of how are they thinking about meeting people where they are and building that credibility. And he summed it up really beautifully with proximity and trust. So it's, you're going to places where these young people, where these families are actually spending their time, and those are places where they actually sort of trust in those institutions, those leaders. So that could be schools, that could be community centers, that could be churches, that could be sports teams, but really there's a level of understanding required of the actual lives of the people you're trying to serve, which involves that co-creation and that listening, because you're not just gonna inherently know that. But really understanding, okay, where are the places where I can actually meet these people so that they know that, this solution is available to them and it'll be something that they'll actually try. And on the topic of the election, it's, you've got to have a ground game, right? Not everyone's going to get their information online. They're not going to necessarily go to their insurance portal. I rarely do that anyway. And so having just these multiple ways of reaching and engaging people is really critical, particularly for young people, particularly for their families. And so I'm encouraged to see more people thinking about what happens after the contract.
John, you want to add? I know you've done a lot with schools too.
No, I mean a couple different things. One, we've been talking a lot about startups co-designing with youth, super important. But also the ones that I think we're seeing go the fastest gets at a little point that Aaron was making on the business side, like who's going to pay for it. And there's an element of co-designing with the folks that pay for this, and that means engaging plans and Medicaid early, both to help sort of cultivate that support, because they don't move at startup speeds, and it's a very sort of methodical, long process. And so engaging them early just helps inform the business sort of structure and solutions there, and just helps with co-designing. It makes you go, you have to go a little bit slower to go faster. But I think we've seen a lot of solutions that were great tech products, had huge success and sort of popularity with the youth they were serving, and then there just wasn't the payer on the other side, and then you saw the business sort of fizzle out a little bit. Also, this notion too of just going to where the youth are is just so important. I think it's the reason we're just excited about Hazel Health, and it really does come down to the trust they've earned with school systems. And because if you think about it, it's not, school systems they're risking a lot. They're not just contracting with someone to help provide telehealth and teletherapy services. They're making that recommendation to parents as well. And there's a huge amount of trust that comes through that. Hazel's got just an amazing sort of team to help sort of cultivate at every one of those different stages as well. But and lastly, I just think this is, we started with policy at the beginning, but this is also, I just don't think you can engage government officials early enough, because what we noticed through sponsorship with the National Governors Association a couple of years ago, I know many of people in this room sort of participated in this youth mental health arc over a year or 2 years, is that a lot of folks in public policy and Medicaid plans just don't know about the innovations that are out there. And they think in very sort of traditional ways. We had a lot of governors who were like, the way we're going to solve the youth mental health is to pay for a counselor in every school. Important, but also probably not possible. And they didn't know about some of the technology and other types of solutions that were out there. So there's an amount of like, it's not lobbying, it's not advocacy, it's just making them aware of what's possible so they can start folding you in their budgets, in their plans, as well as some of their other policy reforms as well.
And I think pairing investment with policy change is really important, and that's something that we do at Pivotal as well. A lot of the ways that kind of reimbursement and billing codes are defined were built up systems in the 1970s that were really assuming a small percentage of adults, mostly males, would be using the mental health system, and that's obviously not the case today, and something that a lot of entrepreneurs are up against, kind of trying to work around these out-of-date billing codes. Up until 4 years ago, teletherapy was reimbursed at 60% the rate of in-person therapy, and we know that that's not how young people, or really most people, want to engage with services, per the Rock Health Report. So we think we need to see some of those policy changes get updated, and that needs to be informed by the way young people interact with products. And I've seen the Headstream team do that in real time, and entrepreneurs pitch investors and then have to pitch a high school classroom and say that that was way more terrifying than actually trying to go get funding. And the great celebration when the teenagers said the vibes were good on any given product. So I'd love David to give a little bit of voice to that. But I also think that building on what John said, engaging channel partners early, engaging those who will be buyers early, is something that we look for upfront with any deal that we consider. Is what is your distribution plan? Do you already have partnerships lined up either with health systems, with state plans, with school districts? Of that kind of first place of practice is really critical with an intention to scale. And that's something that the Headstream team has also done a lot of work on with the K-12 Navigator and thinking about the buyer side.
Yeah, I mean, thank you for that segue. And John, you started talking about it with the sophistication and awareness of what those customers out there understand there is. There are a lot of amazing solutions out there, and I think that we put the onus on the entrepreneurs to be the ones that are constantly like chasing and pushing out to get their solutions out there and to build that awareness. One of the big priorities that we have at Headstream this year and moving into the next couple of years is to do a lot of that customer education. So we're bringing the customers closer to the types of entrepreneurs who are impact driven, who are bringing their lived experience into the work, who are co-creating with young people, so that those entrepreneurs have a little bit of an easier pathway to do that. We were really honored to do that this year with the Jed Foundation and Meadows Institute of Mental Health Policy. We recently released last month the K-12 Mental Health Tech Navigator that's built for schools and district leaders to understand how they might integrate digital interventions into their school, for their students and for their school populations. We know that for young people who are on Medicaid, of those who get support, 80% of those young people get mental health support through a school or school adjacent space, right? And so if we want to meet young people where they are, particularly underserved young people, let's do it through schools, and let's help those schools that are now taking on an additional burden of educating and now providing healthcare for our young people. Let's help them understand how digital interventions can supplement the amazing work that they're already doing.
If you have a question, come stand at this microphone. and we have some questions coming in on this iPad I'm learning about. But come stand here if you want to ask one in person and say who you are. And Dodge asked, sort of relates to something that's come up a couple times here, but so many of these solutions are mission driven and founders are interested in working collaboratively. How do we build an enabling environment for these types of collaborations? It's a little tricky in our capitalistic society as we're raising venture. Collaboration can be really hard, but how do we build that kind of environment, or examples you're seeing where that's supportive to some of these founders in particular? I mean, I would start with BHT right here. Thank you, Solomon.
Yeah, I mean, it's a good question. And I would say that this is also a call to action for our fellow investors in the room. With some of the most successful models that we see in the behavioral health tech space, particularly for youth, we need more patient capital. The money is there for Medicaid solutions, for school solutions, and it will take a slightly longer sales period than in some other sectors to really return on that customer acquisition, that growth cycle. And so to stay the course and to not push companies to pivot too soon when that money will eventually come in. And I think that we have seen some behavior change from investors who are really interested in this space, but that is part of where we can kind of marry the return with the impact work that we really want to see.
I would also say we're seeing examples both in our portfolio and in the ecosystem more broadly where digital health startups are partnering with each other. I think most of the work that people in this room do is more complementary than competitive at the end of the day, and really thinking about, okay, who's the ecosystem of founders, not only that you as founders can learn from and sort of share notes with, but also, you know, if you're providing, let's say, services for moderate to severe anxiety, and you're finding that there are comorbidities with eating disorders, that's not something that you have to build in-house. There are companies that, like Equip, that provide care for eating disorders. And so I think really seeing the opportunity to build deep expertise in your lane and to partner with a lot of these fantastic companies on the ecosystem, my hope is that places like BHT provide the opportunity to even meet and learn about the solutions that are out there. I think there's enough need and enough companies that there are real opportunities really to bridge, to partner, to refer, to even go to market together as a more holistic solution rather than selling a bunch of individual point solutions to payers who are frankly feeling quite a bit of fatigue around that. So it's maybe a call to action to investors, but also to founders to really think about where are those potential complementarities where you can sort of combine your services with those of another to create something that's greater than the sum of the parts.
Yeah, I'll say, I mentioned it earlier that I'm sort of new to this sector. I mean, I've worked in other sectors too, including education and carbon capture and tech. The one thing I've noticed being new into the behavioral health area is that this is a remarkably collaborative community. And I would say like lean into that, embrace that, because that makes you unique compared to other sectors that I've been involved in. I just want to double down too on something Kelsey said, that it's up to us as investors and philanthropists to also set that tone and to encourage the collaboration, create space for that collaboration, set those tables. BHT and other events are really important like that. Rock Health's annual summit, also a good place. But it's up to us to kind of set that tone and set that expectation. And then lastly, I mean, Kelsey also sort of started the conversation with this too, but we're at a unique moment. This is a bipartisan issue. We saw that with governors, with the NGA initiative. We've seen it in other sorts of ways. We've seen it with the Surgeon General's report. You see plans wanting to prioritize this. I mean, that is a moment that we have to take advantage of, and that's a moment to work collaboratively, because these moments, you know, they dissipate over time, and so we have to just take advantage of the momentum. And again, work collaboratively to help kind of extend that as long as possible and kind of keep moving the solutions forward there.
Would you like to ask your question?
Yeah, sure.
We have about 5 minutes left. I have one last question for all of you, but we'll
Sure.
take your question.
Question is, you guys have been talking a lot about solutions, like how to find solutions, entrepreneurs, whoever, investors. My question is, working, unlike the medical space, so like physical medical health, where it's much easier to measure outcomes. In this space, it's a data, do any of you recommend a specific software company to use that measures outcomes?
I don't have a specific software solution. One of the things that we've seen very effective, right? Partners could recommend different types of software solutions that they've used. But one of the things that has worked really well is finding partnerships with academic institutions to do that research and to understand, right? And I think one of this moment in time that you're talking about, John, is also more folks are wanting to research this. More folks are going into this space, and there's a lot of resources that are out there to find that type of partnership. And so we're starting a partnership with the University of Virginia as an example so that they can support the entrepreneurs in our accelerator to be able to do some of the research and do some of that studies around the efficacy of the type of solution that you might be doing. I think that would be my suggestion for that. Anybody else?
I think there's more funding streams from SBIR grants and ARPA funding that can help with that kind of early stage evidence base as well. But ultimately, when we're talking about mental health, we're talking about a lot of different conditions, a lot of different experiences. And so kind of understanding what is going to be bespoke in your area varies across the field. We look for evidence-informed practices, recognizing that a lot of what is considered evidence-based is, again, based on outdated models that were built in kind of more than 30 years ago. So while we're continuing to build more diverse data sets, more diverse clinical trials, we want to see that academic partnership, that research partnership, but also that it is based on evidence, not purely on out-of-date systems.
Okay, ask your question real quick.
Hi.
But I want both of you to ask your questions real quick, and then
We'll be quick.
we'll end. Yeah.
Hey everyone, if you don't know me, my name is Patrick. I am the CEO of Somethings. We're a peer support-driven mental health intervention for adolescents and teens. We see a lot of opportunity in Medicaid right now across the adolescent space. And I'm curious how, for a few of you that are on the investing side, how are you structuring funds to align better with the extended timelines that are required when you talk about something like a go-to-market in Medicaid or across commercial insurance payers?
And then,
Hi, my question was about.
will you tell us your name too?
Oh.
You might as well. You're at the mic, you know.
My name's Kusum, and thank you. My question was about virtual health satisfaction and how to balance what somebody needs versus what they want. That was a very interesting point. Can you share more about what you meant by there's a lack of satisfaction in virtual health, and who's doing well to address it, and what are they, who's not?
Okay, we're gonna popcorn down here because we have 1 minute left.
Maybe on the question around sort of how we are or maybe are trying to fund patiently toward Medicaid, which gets to Patrick's question as well as something that Kelsey said. Something that we're thinking a lot about as investors is really around, not necessarily structuring deals differently, although there may be opportunities to do that, but really around governance and timing. So on the governance side, I think something that's really important for founders to think about is who's on your board. Do they understand sort of the sales cycle that you're working toward, and are they aligned with that? And you have sort of the support and the patience there to give you the latitude to actually build out the model on a time frame that might be a little longer than sort of the typical venture you're fundraising every 2 years. So I think there's an opportunity to be thoughtful and discerning in terms of who's actually in that room with you, shaping and governing the company. And then the patience piece, which Kelsey said, which is, I think as more companies are serving Medicaid, we now have a better sense of the timelines. And so there's just this opportunity, frankly, to be realistic and to say, okay, we understand that this is likely going to take, let's say, 18 months, maybe 3 years to really prove out that there's, a repeatable model here. And so funding with enough runway to actually accomplish that. Sometimes we talk about just sort of the realism that it feels like it's lacking in these conversations, where a lot of venture timelines are tied to, SaaS tech, and we're trying to apply those to digital health, and there's an opportunity for us all to sort of level set on how things actually work in this real world and to fund toward that goal.
Maybe just two thoughts. One, it goes a little bit back to what I was saying before, that we have to educate sort of a whole generation of investors about the longer timelines here. Like if you go into some areas, like I do some work in direct air capture, like those are timelines that take 10 years, and the investors pouring money into that know that. And so I think this is a little bit on some investors that just need to be sort of cultivated and supported to kind of understand the longer timelines for the plans. And again, it's that demystifying and de-risking on that. And then lastly, on the telehealth, I think what we've seen with a lot of companies is that the tech stack is truly that. Like you're sort of cobbling together different parts of tech services, and that sort of functionally works, but the user experience, and it's user experience in two ways. One for the patient, for the child or the youth, but the other is for the provider. And I think there's a lot of ways, a lot of room there to make both experiences better, both for the youth that we're serving, but also how do we just use tech to make the lives of providers easier? And there's a lot, I think we're seeing with AI to help with like reducing no-show rates or reducing some of the note-taking, but anything we can do to make providers' lives easier so they're freed up either to recharge or to spend more time with youth, that's a win too. But that's like really focusing, I think, on the user experience as opposed to just the technologies that we're sort of cobbling together and hoping that delivers a service.
I'll also add on the satisfaction side, at Pivotal Ventures, we focus on women and girls, youth of color, and LGBTQ plus young people. And these are individuals who often have a lot of distrust for good reason of the health system. They've been systemically harmed and marginalized by a lot of healthcare providers over time. So when we think about services, particularly in kind of the teletherapy space, how is trust being built with these young people and their families over time? And with the arrival of AI and a lot of the teletherapy models that maybe you get a different provider every time who's looking at notes, who's then referring you to a chatbot in between, that really just does not build the trust that young people need to have when they're talking about really vulnerable experiences, especially if their home is not a safe place for them. So really having a safe human, consistent outside point of contact is a really big part of what we see as important.
That trust piece is so important. I think if we all imagine 10 years into the future, what technology is going to look like and what these interventions look like, the tech is probably going to be pretty similar, right? And so how do you build trust? How do you build that community? How do you build solutions that bring in lived experience, that bring in cultural competence, that bring in age appropriateness?
So for the last 45 minutes, we've been on this stage, but there's certainly a ton of expertise in this room, and so we're going to get off this stage now because our time is up. But I'm thrilled that we had this at the top of the week so that we can actually just hang out together and talk more about all these things that just got started up here. So thank you for your attentiveness. Thank you for coming to this, and thank you to all of you. I love working with all of you.